This is Laura from Front Office Rocks, and I'm with Rohit from Practice by Numbers, and we're in another video jumping into really knowing your numbers. That's what's super important that we both agree on as a front office rock star and as the designer engineer of this wonderful software. One of my frustrations when I talk to dental offices is I ask them questions like, what is your case acceptance? Or, just details that we want to know. And a lot of offices can tell me like what their case acceptance is, but they can't tell me how they're fixing it or what they're doing to improve their case acceptance, for example. So I wanted to jump into Practice by Numbers in this little area, which is the provider treatment planning section. We have another video specific to explain, where the case acceptance numbers come from. But what I love about Practice by Numbers is it not only tells you how you're doing, it gives you an opportunity to improve in that area. So I'm going to have Rohit show us here. We've got the treatment plan acceptance and the treatment plan by provider, but it actually lists who accepted treatment, how much they accepted, who didn't accept treatment, and we're going to talk about how this can help you get a higher case acceptance in your practice. So let you, Rohit, take over and explain what we're looking at, and I'll jump in a little bit if I've got my 2 cents.
Okay, perfect. Thanks a lot, Laura, and welcome everyone to another video with Front Office Rocks. We talked about the high level information about looking at your treatment plan presentation and acceptance. Now, this is not just pretty numbers. One of the things that I want to state is that in terms of treatment acceptance, there is no norms. There is no standard data that you can say, I want to aim for 62% because that's what my friend has. It doesn't exist. What treatment plan acceptance and presentation and acceptance is, you have to establish the baseline in your office. You have to know what you are doing. Once you establish the baseline, let's say that baseline is 35%. Then you make changes and see if you're able to improve both your treatment acceptance, as we talked about, and your patient acceptance, okay? And you make small changes and you see what's happening. You can make them week by week. You can make them month by month. Now, the right side, on the left side, we show you high-level numbers. On the right side, we show you the actual patients, their treatment plan name, when it was created, what was the size of that plan, and how much of that was accepted. Okay. So now, if I'm looking at this particular month, here's the list of 51 treatment plans that were presented. And here is a patient restorative, was done on the 14th. The plan was $6,300, and none of it was either completed or scheduled. I'm not sure what happened with this particular patient, but it's important to have a follow-up. There should be a follow-up within a few days, maybe let's say 2 days after the patient leaves, to 2 or 3 weeks after the patient leaves, to 2 months after the patient leaves. There should be a follow-up on every single treatment plan. And yes, most offices don't do that. And Laura, I'm sure you have something to say about that.
Yeah, and I'm not going to get into, I have all my videos that talk about treatment plan follow-ups and how to do it and what we need to say and all of that. But I do want to point out, we're not going to go into it in this video, but the reason I got super excited about Practice by Numbers and how I got my team using it is I had one of my employees, my doctor scheduler, come to me and said, there's no one else to call. I've called everybody. Well, if you work in a dental office, as soon as your employee says there's no one else to call, there's a problem. And she was working off paper lists and the most recent treatment plans, and she had called everybody she could call. And we work with Eaglesoft, and Eaglesoft's good, but it takes a lot to pull information out of it. Who's been diagnosed for crowns or who's been diagnosed for treatment. Well, I said, let me show you Practice by Numbers, and we take this list, and there's an actual place that our team can go now, and they can start following up on this list. So it gives them real-time lists of who hasn't been closed and who do we need to follow up with. So yes, this is great for us at a high level to go, all right, well, how are we doing a case acceptance? But now there's an actual way your team can use this list and do the follow-up that they're supposed to be doing, because without having the list, they're not calling, we're not getting these patients to come in and get their treatment. So that's what I love most about this is it's a good way for the doctor and the treatment coordinators to stay connected on who do we need to get in, who accepted, how much did they accept. It's real data. It's sitting here right in front of you.
Right. And another thing that this gets used for is day-to-day training exercises. So, for example, just look on a weekly basis, and let's find out if there were any patients seen yesterday. So I'm going to go back. I'm going to reduce this down to just 1 day of data. Okay, just these many patients. So if I go down right here, there should be a discussion that should take place today because this patient came in yesterday. There was a treatment plan presented of $1,800 to this particular patient. It was a new patient. Okay, so that means a comprehensive exam was done and this patient was presented to treatment. How did this patient leave the office without scheduling their restorative? Okay, and it's mostly, here's what was presented. There was probably a crown right here, maybe 2 crowns, and restorative basic, and it was $123.92. That's what, like a 2 surface filling?
Yes.
And they left without any treatment being scheduled. And why did that happen? There should be a follow-up. Somebody should be calling them back today. So our Revenue IQ portion is all about follow-ups. And we'll create a video on how to do follow-ups on treatment that's presented and not scheduled. That's another video.
Yep. And if you're watching this video and you're just starting with practice by numbers, I'm going to tell you personally, because I'm learning practice by numbers right now as we're doing these videos. We're live training right here. My team's already working in Revenue IQ, which is the list of these patients diagnosed yesterday, 2 weeks ago, 2 months ago, 6 months ago. They're working on these lists because it's really easy to get your team just calling on the lists. And so if you're watching this and you want to get your team going, jump ahead to our Revenue IQ portion where we talk about how to get your team calling, because as you're learning this part, they can be actively working on getting the patients back in.
Right.
Now, can you show us one thing I want to talk about? This is talking about what we did yesterday and how, what we need to do going forward about following up with these patients. But I agree with you 100% that I don't want to compare my case acceptance to any other doctor on the street. There's no standard. It's just that you should be looking to improve all the time. So you say we start with a base number and then we can compare going forward. So can you show us the treatment history and then how we can start to track that our office is improving?
Yeah, so let's, I've clicked on the history tab right here, treatment history all. This is for all patients. And I'm going to change this time frame to, let's say, the last 12 months. Okay. So what this has done is it's showing me all of the treatment that was presented and what has been accepted. And I can look at it per treatment. Okay, per provider. So I can pick, let's say, one of the providers right here. So I'll pick Dr. Washington right here. And of what has been presented by that doctor and what's being accepted by the patient. So the top number shows treatment accepted by type and the bottom number shows treatment not accepted by type. And the third graph here is also quite interesting, is to see what is not being accepted, because sometimes it doesn't make sense to keep presenting certain treatment, especially some of the elective ones, if they never ever get accepted. And you have to ask yourself that question: why is that not getting accepted? What are we not offering to our patients so that they would say yes? Is it financial? Is it a payment option? Is it an in-house VIP? Meaning, what is it that will help increase it? And the history graphs is what they show. And you can look at it for the whole office, or you can look at it. So I can look at it for all providers. Or I can drill down to a different level and I can look at a different provider, for example.
And I agree with you. I think it's good to look at this to see what can we do to help get this treatment accepted. I also personally like to look at it by provider and see how they're doing. Because let's say you have a provider that was doing really well at presenting and getting acceptance to something, and then maybe it changed. Well, we want to look at what changed. Maybe a patient or an insurance denied something and they got, worried about it, like the insurance didn't pay for the onlay and now they don't present onlays as well. Or maybe your doctor's just not good at presenting a certain type of treatment. Maybe they're not super skilled in periodontics. They don't really fully understand perio. So then we need to do some training. Let's get our doctors trained in an area so that they can present, because you shouldn't have anyone presenting treatment that's not 100% comfortable and confident that that treatment's going to help the patient. So there's a lot of different aspects you can take this. look at it as a high level. Where does our office need, overall training? What do we need to do to change to get case acceptance? Or do we need to do it at a provider level? So I really like this, and it's really easy to see. I mean, it took him 2 minutes to click into here and say, all right, how are we doing compared to last year at this time?
Right. The different providers, so looking at the percentages of what is presented and what's accepted, for example, what's the relative percentage, relative distribution of restorative major, crowns, and bridges compared to fillings from one provider to another provider. If you randomly assign patients to all three providers, their percentage of what they're presenting for basic versus major shouldn't really vary, right? Relatively, it should be pretty similar. And you have to take a look at it to see what's happening and is there a training issue or is there an education issue going on.
Exactly. Now, just for my own purposes, because we're about to dig into this in my office, treatment plan presented by type, I totally understand that. That falls under the category. Treatment plan accepted by type. Now, this is what doctor presented the treatment and then what got scheduled. It doesn't matter which doctor actually did the treatment, correct? Because we have different doctors in our practice.
Right. So what we're looking at is if the treatment was presented by a doctor, if it got accepted by that patient for any provider.
Okay. Okay. So that's good to know. And again, in another video, we talked about this, but this comes out of who did the exam code or the consultation code. That's who gets the credit for presented and accepted. And the biggest thing out of this is I know it's overwhelming looking at it at the beginning, but if you actually start taking action steps to getting your team making phone calls, looking at what you're presenting, how are you doing, looking at it, I don't know that I would say I would look at this every single day, but on a month-to-month basis to see how are you doing last month compared to this month, then go back to the provider treatment planning page on a more of a daily basis to say, are we doing good at case acceptance? Because I'll be honest with you, doctors, if you don't know this already, the patients tell you that they're 100% on board. And you leave the consultation room or the chair side feeling you've closed everybody, then they come up to us and we tell them how much it is, and then you see 0 accepted, 0 scheduled. So looking at this and knowing, wow, I didn't get everyone to schedule. Maybe you need to improve a little bit of your presentation skills, or maybe your staff need to be really good at follow-up. And that's where Practice by Numbers can help you with that. So I love this. I can't wait for my doctors to see this and start implementing it. And then getting my team, like I said, already on the phones to get these patients, not these, but my patients scheduled into our schedule. So thank you, Rahit, for this. This is really awesome information.
Okay, you're welcome. And thanks everyone. And we'll be back again with another video.